Good afternoon, everyone. Thank you for joining us. Before I move on to today's update on COVID, I want to say just a few words about Friday's knife attack in the city of Glasgow. During the briefing on Friday, I commented on what an exceptional job our police service was doing in enforcing proportionately and sensitively the lockdown restrictions. But Friday afternoon reminded us of another side of the police's duties. It reminded us that in order to protect all of us, the public, our police officers so often run towards danger despite the risk to themselves. Now, we're considering what further lessons need to be learned from what happened on Friday. Aileen Campbell, the Community Secretary, is discussing the safety and well-being of asylum seekers in a phone call with the UK Government later today. But for the moment, I simply want to take this opportunity to thank all of the police officers involved in dealing with Friday's attack. They showed outstanding courage, dedication and professionalism, and through that undoubtedly avoided a very serious situation indeed becoming even worse. I also want to praise our medical services, including, of course, the Scottish Ambulance Service, for providing such effective care so quickly to those affected by the attack. And my thoughts are very much with Constable David White and with everyone harmed in Friday's incident. I hope all 6 people injured make a full and speedy recovery. My best wishes go to them and to their loved ones. Now, let me start the COVID part of the briefing by providing my usual update on the most recent statistics. I can report today that an additional 5 positive cases were confirmed yesterday, which takes the total now in Scotland to 18,241 confirmed cases. A total of 740 patients are currently in hospital with the virus, either confirmed or suspected. That is 38 fewer than yesterday overall, and there has been no change since yesterday in the number of confirmed cases in hospital. A total of 10 people last night were in intensive care with confirmed or suspected COVID, and that is 3 fewer than yesterday. And since the 5th of March, a total of 4,051 patients who had tested positive for the virus and required hospital treatment have now been able to leave hospital. And in the past 24 hours, I'm pleased to report that no deaths were registered of a patient confirmed through a test as having COVID-19. The total number of deaths in Scotland under that measurement therefore remains at 2,482. This is the 4th day in a row when no deaths of patients confirmed through a test have been recorded in Scotland. Now, of course, 2 of these days have been weekends, and we know that registration can be artificially low at weekends, and we may see more deaths registered later this week. But there's no doubt that these recent figures demonstrate beyond any doubt how much progress Scotland has made in tackling COVID. And that is down to the efforts and sacrifices of everyone across the country. And I want again to say a heartfelt thank you to all of you for that. Our challenge now, and it is a big challenge, and it will again depend on the efforts of all of us, is to continue that progress, while at the same time reopening more of our economy, restarting more of our public services and seeing more of our family and friends. And of course, the tally of total deaths that I have reported is a constant reminder and should continue to be a constant reminder of the human toll of this virus and why our efforts to contain, control and hopefully eliminate it are so important. Everyone who has died due to this illness was a unique and irreplaceable individual whose loss right now is a source of grief to many. And I want again today to send my deepest condolences to everyone who has lost a loved one as a result of COVID-19. And again, let me express my thanks to our health and care workers and indeed to all of our key workers. The progress we have made to date is in no small part due to your dedication. The entire country is grateful to you for everything you have done and indeed everything you continue to do. Now, I have 2 key points I want to briefly update on today. The first relates to public finances and the economy, and I'm joined today by Kate Forbes, the Finance Secretary. Today, and I will return to this briefly at the end of my remarks, we're seeing the reopening of significant parts of our economy. Later this afternoon, I'll be discussing how we continue that restart safely and sustainably at one of the Scottish Government's regular meetings with the Scottish Trade Union Congress. In addition, the Scottish Government has published a paper today which puts forward some hopefully constructive proposals for how the UK as a whole can and needs to stimulate economic growth in a way that is both fair and sustainable. The paper proposes an £80 billion stimulus programme, roughly comparable in ambition to the one that Germany has recently adopted, and it has a particular focus on investment in low-carbon and digital infrastructure. Our proposals would also provide an employment guarantee for young people. We're also suggesting a temporary cut in VAT to boost consumption, with especially low rates for our hospitality and tourism sectors, because they have been particularly hard hit and are likely to be hit for even longer than some other parts of our economy. And alongside those UK-wide proposals, we propose that Scotland should gain greater financial powers, for example, over borrowing, so that we can shape our own response to the economic implications of the pandemic. The economic crisis caused by COVID-19 is undoubtedly the most serious of our lifetimes. The Scottish Government's proposals are therefore ambitious, but also practical and sustainable. And we believe that they would benefit not just Scotland, but the whole of the UK. Central to them is the strong belief that the austerity mistake of the post-financial crash period must not be repeated, and that debt must be managed over a longer time period. We hope these proposals will be considered carefully and seriously, and we will of course happily discuss the details of them with the UK Government. The second issue I want to touch on briefly today is the issue of air bridges. The UK Government made its announcement on what are called air bridges, which allow travel to and from certain countries without quarantine restrictions, unfortunately without any prior consultation at all with the Scottish Government. As a result, we are still considering our response and our own proposals. The Justice Secretary, Hamza Yousaf, was part of a four-way phone discussion with Michael Gove and the other devolved administrations earlier today. This is an issue on which we have tried very hard to work closely with the UK Government and other devolved administrations, and we can and do, of course, see the benefits of adopting a consistent approach across all parts of the UK. However, we also know that quarantine measures, albeit perhaps on a more targeted basis in future, may become more important in Scotland rather than less, as our infection rates fall, since then the relative impact of new cases from outside Scotland potentially become greater. And of course the prospect of cases coming in from elsewhere poses a risk not just to health but also to our economy. We therefore want to take a bit of time to consider the public health impact of the UK Government's proposals, as well as the data and evidence underpinning them, which hopefully we will see before too long, and we will make a further announcement once we have had the opportunity to do so. The final point I want to make relates once again to our key public health measures. As I said earlier on, today sees a significant resumption of activity in key public services and in our economy. Optometry services, for example, are now resuming. And from today, women who had a cervical cancer screening scheduled before that service was paused can contact their GP to arrange a new appointment. In terms of the economy, many factories, warehouses and laboratories can now reopen. The construction sector can move to the next phase of its reopening plan. House moves can also resume. And of course, most non-essential retail premises are able to reopen from today with appropriate physical distancing measures in place. We're also recommending that everyone should wear a face covering in a shop, unless, for example, you have a medical condition which makes that difficult. But I would strongly urge everyone else to wear a face covering. It is a way in which you can protect other people. You're less likely to transmit the virus to them if you are wearing one, and everyone else who is wearing a face covering is in turn helping to protect you. I know that wearing face coverings takes some getting used to, but please get into the habit of it now, because it does add to the protections we want to confer on each other, and it is one measure that helps us to reduce the risk of the transmission of COVID-19. This gradual reopening of our economy and our public services is of course very welcome, and it has been very hard earned by everybody across the country. And of course the figures I've just reported demonstrate once again just how much progress we have made in recent weeks. But please don't think because of this that life should be completely back to normal, or that the risk of COVID has somehow disappeared. It has not disappeared. The virus has not gone away. There are still, as I reported today, hundreds of people in Scotland in hospital as a result of the virus. There are still new people becoming infected every day. And although those numbers are low, this is a virus that we know is still highly infectious and very dangerous. and it will start to spread rapidly again if we give it the opportunity to do so. So please, even as we all go out and about more and do more things, do not give it that opportunity to spread. Our public health campaign, Facts, summarises the key points all of us need to remember and to abide by. Firstly, face coverings should be worn in enclosed spaces such as shops. They are already mandatory on public transport. Second, avoid crowded places. Crowded places are a danger, even if they are outdoors. Third, clean your hands and hard surfaces that you touch regularly. Fourth, 2-metre distancing remains the advice. And lastly, self-isolate and immediately book a test if you have any of the symptoms of COVID-19. If all of us remember these 5 basic measures, then all of us can help to stay safe ourselves, help to protect others, and ultimately help to save lives. So please continue to do all of that and to stick with these rules. If you do, we can and we will sustain the progress we've all made. My thanks again to everyone who is doing that. I hope it is becoming clearer with every day that passes what a difference it is all making and why it is important to continue with that discipline. Thank you very much indeed for listening. I'm going to hand now to the Finance Secretary to say a few words before we move on to questions. Kate.
Thank you, First Minister. We know that COVID-19 has brought about a twin health and economic crisis, and that's why since the start of this crisis, we've been working tirelessly to counter the pandemic and have invested just over £4 billion to support every part of the country. But we're now looking beyond the immediate emergency response to the crisis in order to rebuild our economy. And as we respond, the challenge is that the Scottish Government does not have the full suite of powers at our disposal in order to meet all of the economic challenges. Key economic levers like tax and borrowing powers lie with the UK Government, and their decisions still determine, both in terms of the size and the shape of the Scottish budget, and therefore by extension, the resources we have to respond to the economic crisis. Last week, I formally requested new financial powers from the Treasury that would allow the Scottish Government to use its budget more effectively and borrow up to £500 million more this year. I've also requested additional flexibility to reallocate any unused capital funding on day-to-day spending. We need as much flexibility as possible to tackle this economic crisis, and so the Scottish Government must get from the UK Government either the funding or the powers to respond to those challenges. But this crisis also requires a new approach from the UK Government. So today, we've published a paper setting out the principles that we believe the UK Government should follow to manage the UK's public finances and to kickstart the economy. Our number one priority is to ensure no return to the damaging austerity of the past. Austerity would damage our economic and social recovery from COVID-19. The UK Government must adopt flexible fiscal rules so they can reprioritise economic stimulus over deficit reduction. That would ensure that our future economy is better able to repay the debt that has accrued. There's also a pressing need for a UK-wide stimulus package to regenerate the economy and reduce inequalities following the pandemic. It needs to be bold and ambitious. We suggest a total package worth £80 billion is equivalent to 4% of UK GDP. Germany has already adopted a similar size stimulus package, and the UK needs to be just as proactive. The package could finance a temporary reduction in VAT and move the tourism and hospitality industries onto a reduced VAT rate. It could also cut employers' national insurance contributions to reduce the costs that businesses are facing as they try to maintain or increase employment. Such a stimulus could also introduce a jobs guarantee scheme for young people and extend sector-specific employment and business support schemes. I'm calling for a national debt plan to help businesses and household budgets recover from the effects of the pandemic. And I'm also appealing to the UK Government to choose to use public money to protect jobs and livelihoods through schemes that support the economy rather than taking no further action and then having to pay for unemployment benefits. So let me finish by saying that whilst we're calling on the UK Government to adopt a new approach, we will continue to use every lever and all the resources at our disposal to ensure that we rebuild our economy and our society.
Many thanks. Indeed, Kate. I'm going to move on to questions now. I would remind you that the Chief Medical Officer is also with us today and will assist us in answering the questions. But the first question today is from Nick Sheridan from BBC Scotland.
Good afternoon, First Minister. You mentioned the concept of air bridges there in your briefing. Can I ask, if we see a situation where other parts of the UK are seeing higher infection rates than Scotland or are seeing rising infection rates, might travellers from those parts of the UK, for example, England, need to quarantine upon arrival here in Scotland? And can I also ask you, have you yourself put in a leave request for a foreign holiday this summer?
I have no plans to take a foreign holiday this summer. I think from my vantage point now, I'll be lucky to get any holiday this summer, but we'll see what happens. In terms of the first part of your question, this may be a vain request I'm about to make, but before I answer this question substantively, because it is a legitimate one, can I ask people not to seek to see this through the prism of Scottish politics or the Scottish constitutional debate, because that is really inappropriate. These issues are first and foremost and in fact entirely about public health. Right now we have no plans to introduce quarantine for people coming to Scotland from other parts of the UK, but there is a general issue that we have to consider as we go further through this pandemic. As our infection rates continue to fall, and they are falling now, and I very much hope that they will continue to fall, we have to be on our guard against cases coming into Scotland from elsewhere. That's why, for example, we are taking the time to consider the UK government's proposals around air bridges for the arrangements between the UK or parts of the UK and other countries. So if we did see an ongoing divergence between infection rates and levels in Scotland and other parts of the UK, from a public health perspective, we would require to give consideration about how we mitigate that and guard against infection rates rising in Scotland as a result. And as I said at the outset, this is not political and it is certainly not constitutional. And I know we will have this debate very much in a Scottish UK context, but I would ask people to look at examples from other parts of the world. Right now, I believe if you're travelling to New York or New Jersey from certain other states in the US, there are quarantine or other arrangements in place. Similarly, in Germany, for example, there are arrangements to impose some kind of restrictions like that in terms of travel between one lander and another. So this is something that other parts of the world are already doing or considering. Now, I hope that need won't arise, because I very much hope that we will see infection levels fall in Scotland as they are right now and fall in the rest of the UK. And also, I very much hope that where we have localised outbreaks or clusters of infection, it will be possible to have effective localised measures in place to try to contain that. But from a public health perspective, we have to be able to consider all options if it is required to try to stop a resurgence of infection in Scotland. And there's a basic objective and imperative for us here. If we want to get back to normal, and for example, if we want to see our children back at school full time in August, as I think all of us do, we must keep infection rates low. And they are low right now, they are hopefully getting lower, but all of that return to normality is jeopardised and put at risk if we see infection rates rise. So that means continuing to do the right things within Scotland and continuing to be on our guard about cases coming into Scotland. But hopefully we will see infection rates reduce across the UK and these things don't arise as practical issues. Gordon Cree from STV.
Over the weekend, the preeminent expert on coronavirus, Professor Devi Sridhar, said that Scotland was on track to eliminating the virus by the end of the summer. If we get there, how close to day-to-day normality could we return?
Well, Devi Sridhar is an eminent professor and expert, as you rightly say. She's also a member of the Scottish Government's Scientific Advisory Group, so she is one of the eminent experts that gives us advice, and I'm very appreciative of that advice. I think it's important to be very clear that the closer we get to elimination, the more normality we get back, and that is why it is so important to have elimination as a clear strategy. I'm very clear that is our objective in Scotland. I'm less clear about whether that is the objective elsewhere in the UK, but I'm very clear it's the objective in Scotland. But elimination is not eradication. Elimination gets you to a very, very low level of cases, but the number of cases won't stay at that low level of its own accord. The virus won't simply disappear because it hasn't been eradicated. So we will continue to need to take measures to keep the virus at elimination levels, and that will mean, while a greater degree of normality may well be possible, things like physical distancing, hygiene, both hand hygiene and cough hygiene, making sure that we, in appropriate circumstances, are wearing face coverings, all of that continues to be important, as is the issue that I've just been talking about, the need to be on our guard against cases coming in from countries that may, at a particular moment in time, have a higher incidence and prevalence of cases. So, we, through our efforts, are earning our way to something that might look, hopefully over the next period, like elimination. But we will have to continue to work hard to keep it there. There's no free pass on this virus until such times as there is an effective vaccine. It will only stay at these low levels if we work hard to keep it there. And that's a really important message for all of us right now. As we start to normalise, to some extent, our lives, we must bear in mind these 5 facts that I keep speaking about, because if we all do that, then we are helping to ensure that the virus continues to fall and we don't see a resurgence of it. Peter McMahon from ITV Border.
Good afternoon, First Minister. Thank you very much indeed. Just to follow up on a question from my colleague from the BBC there. You said you don't have any plans for quarantine between Scotland and England, and yet later in your answer you mentioned the example of America, where in different states there is the possibility of quarantine. So if Scotland and England continue to diverge in terms of the COVID cases, and you want to try and keep it that way, what method would you use? And given that you're going to open up parts of the tourism industry at the end of the week, what's your message to people who want to come to Scotland from England to say self-catering accommodation?
Well, I would ask people to listen carefully to what I'm saying, because these are important issues. I said we have no plans to introduce any sort of measures like this right now, but I'm not ruling anything out for if it is required from a public health perspective. The way in which we ensure that these measures are not necessary, that they hopefully aren't necessary for too much longer for people coming in through international borders or indeed travelling across the UK, is for all of us to try to get as close to elimination as possible. One of the reasons why I would really like, it's not for me to decide this, but I would really welcome a statement from the Prime Minister that England's strategy was about trying to eliminate the virus as well, as opposed to what it appears to me to be perhaps letting it circulate at higher levels as long as it doesn't threaten to overwhelm the National Health Service. So we have to keep these things under review if we want to keep our levels of infection as low as we can get them. And why do we want to do that? Because the lower we can get them, going back to Gordon's question, the more normality we can get back. And one of the biggest prizes of this is getting kids back to school full time. If we see infection rates start to rise over the summer, that will be harder to do. And so all of us need to make sure that we continue to behave in a way that helps to contain it. We will see this within Scotland, we will see it within England. We're seeing it just now, or at least concerns being expressed about this in Leicester right now, about localised outbreaks or localised surges. And again, the more effective local measures are to try to contain that, then I think the less these wider issues become relevant. But we haven't come this far over the last 3 months, surely, simply to allow our infection rates to start to spiral again. So we're going to have to be really hard-headed from a public health perspective here. In terms of tourism, I want to see people come to enjoy the tourist sector over the summer, but we must do it carefully, and people must abide by the public health advice, and that includes, of course, abiding by the requirements of test and protect. And if everybody does that, then we should have a good chance of keeping this suppressed and getting towards elimination. But if too many of us, whether we're living within Scotland or visiting Scotland from elsewhere in the UK, if we don't abide by these rules, that's when we will start to see it quickly running out of control again. So my appeal to people is to enjoy Scottish tourism and everything that our beautiful country has to offer, but to do it responsibly and to do it safely. Glenn Campbell from BBC Network.
First Minister, was it a mistake for asylum seekers to be relocated into hotel accommodation in Glasgow as a result of the pandemic? Are you satisfied with the conditions in which asylum seekers are currently living?
Well, these are largely UK government decisions, and I think you will be aware, and many people will be aware of the concerns that have been raised over a long period of time now by the Scottish Government with the Home Office about the conditions in which asylum seekers are sometimes living. I know that these are concerns that have been raised by Glasgow City Council and by individual members of Parliament. And as I said in my opening remarks, there'll be a discussion between Aileen Campbell and a UK Government Minister later today to look at these conditions and from the Scottish Government's perspective with a view to ensuring that there are improvements made. I represent, as you know, a constituency in the south side of Glasgow. So within my constituency, over the years have been asylum seekers. I have often had concerns about the conditions in which asylum seekers live. I don't want to go into the details or the particulars of what happened on Friday, because obviously there are ongoing investigations. But I do think it is an important opportunity to look again and shine a light on these conditions and remember that shared and common humanity is something that should be the heart of how we treat people who are fleeing persecution or war and seeking refuge and asylum here. Phil McDonald from Global.
First Minister, just to follow up on that question, actually, we spoke to a lawyer over the weekend who said that young asylum seekers shouldn't be essentially cooped up in hotels with older adults who may have mental health issues. So is there any way in the short term for the Scottish Government to address some of these issues around capacity in hotels, given we're also hearing concerns about people who are scared of actually breathing in these confined spaces with strangers?
The Scottish Government, working with local councils, will do everything we can, but I'm not trying to pass the buck here at all. I have a very intense interest in all of this and in the Scottish Government doing everything and anything we can. But these are UK Government matters. Immigration and asylum are reserved issues, and it is the UK Government that imposes the conditions on how asylum seekers live and the restrictions often on how they live. I've, over the period, for example, been an advocate of asylum seekers being allowed to work while they're here so that they can not only provide for themselves but give something back, as I know from my own experience of meeting asylum seekers down the years, many of them want to do, because there is very often a deep sense of gratitude on the part of asylum seekers at the fact that they have been given asylum here. So I will continue to argue for change. I will continue to make sure that the Scottish Government is doing what we can, but some of these issues have to be tackled at source and at root. And for that to happen, that takes a fundamental rethink and change of approach from the Home Office. And I hope that over the period we will see that, and the Scottish Government will continue to argue for it very strongly. Tom Eden from PA.
Thank you, First Minister. Good afternoon. I was just going to ask firstly to you about face coverings and then Dr. Smith about cervical screenings, if that's all right. Willie Rennie's suggested a face covering distribution system, making them available at bus stops, train stations, shopping centres, etc., to try and improve the number of people wearing them in public. Do you think this idea has merit, and is it something the government would consider? And then Dr. Smith, on cervical screenings, and specifically people whose tests were cancelled because of the coronavirus crisis. People in that situation will now have to go to their GP to try and rearrange and get a new appointment. I was wondering, given people's reluctance to trouble the health service at this time, and not to mention the problems getting hold of GPs. Are you concerned this approach risks people falling through the gaps and potentially puts lives in danger?
I'll hand over to CMO in a second. On face coverings, on anything here, it's an approach I've tried to take from day one of this. I'll consider any suggestions that are made constructively, and I will consider that one. As a matter of fact, when face coverings became mandatory on public transport last week, then some of the transport operators did, on an initial basis, make them available until such times as people had been able to arrange their own. So, if and we'll take a decision later this week on whether we're going to mandatory face coverings in retail, then there may be a role to play for that. But the point I want to stress, 2 points I want to briefly stress. Firstly, anybody can, have their own face covering. This is just a bit of fabric to cover your nose and mouth, as long as you follow all of the advice about how to take it on and off. So we're not advising medical grade face masks, and I think that is important. We want to make this something people can do easily themselves. And secondly, I would encourage people, whatever the situation is around voluntary mandatory, to do this now, because we do see evidence that it makes a difference. And as we go into a period where we're all interacting a bit more, every little thing that we do that can reduce the risk of transmission adds up. So whether that's washing hands, wearing face coverings, washing surfaces, keeping a distance from people, you might think that none of these things in and of itself is going to make the biggest difference, although many of them do make a big difference, but all of them together is how we keep the risk of transmission of the virus at the lowest possible level. And if we don't do all of these things, then we really are risking the virus spreading again. And if the virus starts to spread again, then we go backwards. And I don't want that to happen. I feel, I said yesterday, when I see these, particularly the numbers of people dying reduce, I feel, as I'm sure everybody does, just such an enormous sense of relief. But I would not be telling it straight right now if I didn't also say that I have quite an intense sense of anxiety about what the next few weeks hold as well. I do have a worry about people dropping their guard as things start to open up. I do have a worry about infection levels, not so much in Scotland, but in other parts of the UK, being a bit higher than we would want them to be. And I have a serious worry about what we're starting to see in other parts of the world that suggest or demonstrate and illustrate that this virus is still there. And there are some signs that it is on the rise again. So we must, all of us, take every opportunity to reduce the risk of it here. And a face covering is one of the things we can do. It won't eliminate the risk on its own, but it's one other thing we can do to reduce that risk. So please, please do it. Gregor.
So thank you for your question about cervical screening. I mean, this has been a quite extraordinary time for general practice, and I've been keeping in close contact with GP leaders across Scotland over the last 3 to 4 months. We've been discussing the different approaches that have been taken in GP practices to seeing patients. As recently as Friday, I spoke with the chair of the SGPC, Dr Andrew Buist, particularly about cervical screening, and we all welcome the return of this very important intervention that actually is almost unique among screening in that it safeguards lives right across the spectrum of people from various backgrounds. It's one of the interventions which has been known to reduce health inequalities in Scotland, and I think it's something that we should be very proud of. The cervical screening programme restarts today, and I would encourage women to phone their GP practices if they've had to put off their appointments so that they can re-engage and get a new appointment. It might feel a little bit different when you go along to the GP surgery in these times. Your appointments might take a little bit longer, that might be a little bit more difficult to get appointments, and all that's because of the additional safety measures which are being put in place to ensure that proper cleaning takes place between people, that people are using PPE where that's necessary, all these things just to make sure that everything is safeguarded as much as you would expect it to be. But as far as the GPs themselves are concerned, they're very keen now to make sure that these initiatives that have been paused to combat COVID when it was at its height are now restarting so that we can get on with the business of identifying those other health needs within the community that need equal attention.
Thanks, Gregor. Scott McNabb from Scotsman.
Thank you, First Minister. You suggested earlier that you fear the approach in England may now be to let the virus circulate at a manageable level, whereas in Scotland we're pushing towards elimination. Do you believe then that two different strategies are being adopted in Scotland and England? And also, if I may, on the air corridors, obviously you say you're still considering your response, but given this is a reserved issue, border control, does the Scottish Government have the ability to stop this if you were concerned that may lead to a flare-up in cases?
So on the first part of your question, I know, obviously, you would hope I knew what the Scottish Government strategy was here. We want to get as close to elimination as possible because we think that then provides the best and most sustainable foundation for the future, where we can get more normality back and hopefully, if all goes well, deal with any flare-ups or clusters or outbreaks in a much more targeted way, rather than having the virus circulating at a higher level, where if it then starts to spread again, it quickly runs out of control across the country and we're back into blanket lockdowns. So that's the Scottish Government strategy. What I said was I would welcome a statement from the UK Government that was their strategy as well. But I genuinely don't know whether it is or not. It seems to me that it is perhaps more to let it circulate, not at out of control levels, but at a level that might be higher than we would want to see, as long as it doesn't risk overwhelming the NHS. So I think it would be better if right across the UK we were all working to that strategy of elimination, or as close to that as it is possible to get. On the second part of your question about air bridges, so border control is reserved in terms of who gets to come to the country and who doesn't get to come to the country, but issues of public health measures when people enter the country are to some extent, or to a much greater extent, devolved. And so the regulations that impose the quarantine measures right now are Scottish Parliament regulations, and therefore it is for the Scottish Government to decide what public health measures in these regulations continue and which ones might change, and whether there would be countries that would have different requirements imposed to the generality. And effectively what we need to look at, this is about trying to mitigate the risk of the infection coming in. I remember, or you will remember, a couple of weeks ago when Gregor was reporting on the genomic sequencing work that has been done in Scotland, and what it had found about the numbers of importations of the virus at a very, very early stage, which then meant that community transmission ran out of control. We want to stop that happening again. So we need to look at countries that have, if a country has a lower level of incidence and prevalence of the virus than we do, then it's less of a risk. But if a country has a much higher one, it's more of a risk. So we have to apply very sound public health analysis to this. We've not yet seen, I hope that will change in the course of today, but we've not yet seen the data and analysis that is underpinning the UK Government's decision. So we need to take care about that and make sure that we satisfy ourselves about the right things to do and whether what they are saying is safe or not. Tom Martin from The Express.
Hi, good afternoon, First Minister, and thank you. Obviously, with the shops reopening this morning, we've seen large queues of people gathering to take advantage. I just wondered how concerned you are by those scenes, and why do you think it is people are ignoring or not really taking heed of the message around avoiding crowded places?
I'm going to hand over to Kate in a second just to say a word about the importance of retail to the economy and getting our economy going. Forgive me, maybe that I've not seen all of the pictures that you're referring to yet, but I've not seen anything on social media this morning that would give me the kind of concern that I felt on behalf of the UK Government when I looked at some of the pictures in London when retail opened there of people crowding together without physical distancing. I've seen queues of people waiting to get into a particular shop or shops, but it looked to be reasonably physically distanced. So I hope that continues. And of course, even the pictures we saw in south of the border, it doesn't take that many people to make a photograph look crowded. And you've got to remember that is still quite a tiny minority of the population that are there shopping. I will be concerned if I see pictures of people going shopping and not following the advice. So I will be concerned, and I suppose if I did have a concern about some of the pictures I saw this morning, is that there weren't enough people wearing face coverings. So that's why I'm appealing to people, if you're going shopping, wear a face covering. I will be concerned if I see pictures that show people are not respecting physical distancing, or that shops are allowing too many people in. I've not, apart from the face covering, I've not seen anything like that this morning. But of course we have to continue to monitor this, because every time some of us breach these rules, we are giving this virus an opportunity to spread, and it will take any opportunity, and then because we know how highly infectious it is, it will run out of control again. So I'm appealing to everybody to memorise those facts and make sure that you abide by these rules when you're out and about. Kate.
Thanks. Yeah, of course, trying to ease our way through the next phases in terms of the route map is critically important in terms of economic recovery. But perhaps even more important than giving indicative dates to each of the sectors is ensuring that customers and consumers have the confidence to go back out and to start shopping again. And that is contingent, of course, in them feeling safe. And that's why facts is so important, and why it's so important that people are wearing face masks. Because the more that those are still at home see that they can return to retail in a safe way, hopefully that means more consumers and customers are returning. And that is the way that we will see economic recovery.
Thanks, Kate. Callum Ross from the P&J.
Thanks, First Minister. You mentioned the immigration system and border control earlier. I wondered if I could ask you about the situation with some fishermen from outside the European Economic Area, some of whom seem to have been left stranded at Scottish ports during lockdown. A Scottish Government spokesman has told us is deeply concerned about the health and welfare of some of them, many of whom seem to have been living on boats and harbours. Is this an issue that's been raised with yourself, and is there anything more the Scottish Government could be doing?
I'm very happy to take another look at this and come back to you with a bit more detail. I mean, certainly over the course of this crisis, there have been, and I think I've been questioned at this briefing before, about cruise ships, people being on cruise ships off shore, and there will have been similar issues about fishing boats. But we try to work with local authorities and with other authorities to resolve these issues and make sure that the well-being of anybody on vessels is properly catered for. But if there are specific issues that you want us to take a look at and come back to you on, I'm very happy that we do that. Simon Johnson from The Telegraph.
Hi, First Minister. On bridges, obviously people are jetting away on holiday from this week. I just wondered when a decision will be made, so these people know what they have to do when they come back. And I just wondered if there would be an issue with compliance if people landing at Manchester and Newcastle airports don't have to quarantine when they get back, and people in Glasgow and Edinburgh do. Do you have any sort of concerns that people may just up here may just ignore a new regime if you don't go along with the air bridges plan?
Well, it's not about going along with something, it's about trying to do the right thing. I can't stress enough, I've tried to stress this repeatedly, and I think the vast majority of people get this, but it's worth saying again. I know people know I'm a politician, they look at politicians and there is a reasonable degree of scepticism sometimes in what we say, but all along, this has not been about politics or the Constitution for me. It's about protecting public health, and that's the basis on which I will seek to take these decisions. Equally, I've said all along, partly for the reason you talk about some of the practical issues, that a four nations approach is best if we can agree a four nations approach, because the virus doesn't respect borders or boundaries, and therefore we should try to work across the geography of the UK as closely and as in an aligned a manner as we possibly can. But equally, four nations approaches really depend on a couple of things. Firstly, all of the nations' needs and requirements being the same, and clearly there will be issues there if our relative levels of infection diverge and if our strategies for dealing with it diverge, and we have to keep that under review. But the other thing a four nations approach really depends on is four nations being at the discussions and being joint decision takers. We were told by the UK government, and I'm not trying to moan here about this, but if people want a four nations approach, we have to do it properly. We were told that the UK government wouldn't take the decision that I announced last Friday without that four nations discussion, and then they announced it with no discussion with the other three nations at all. We cannot simply be dragged along in decisions that we have no knowledge of, that we don't understand the basis of, and that might be wrong for our circumstances. I would be failing in my duty as First Minister if I allowed that to happen. So if it is right for us and if we can consider that properly and a four nations approach is possible, I will absolutely want to take it, as we did at the outset of this. But I have to be satisfied that in doing that, we're not increasing the risk of the infection rising in Scotland. And on the timing, as soon as possible, we have to, similar to the general coronavirus regulations, we have to review them on a regular basis, and we hopefully will make our intentions clear over the next couple of days. We have been told that some of the data and evidence that the UK government has used to base their decision on will be shared with us over the course of today, so I hope that that is the case. Christine Lavelle from The Sun.
Thank you, First Minister. It was just following on from Tom's question to Dr Smith about the resumption of cervical screening programme today. Are you expecting a rise in late cancer diagnosis and cancer deaths as a result of these screening programmes having been suspended over the last 3 months?
I'll hand over to Gregor, but if you recall when the then CMO announced this from that podium several weeks ago, well, almost 3 months ago, when Dr Calderwood set out the reason for a pause, it was to try to ensure that there wasn't too much of a delay in people getting their timely appointments, because pausing it meant that when we restarted it, as we are now doing, rather than people completely, maybe if the programme had continued and people had just missed appointments and then it would be their next one in a couple of years before they got it again, people can now get back onto schedule. So the delay will be very small compared to what it would have been if we tried to carry on and people just didn't go to their appointments because they were worried about coronavirus. And as I remember Dr Calderwood saying, but this is the point I'll hand over to Dr Smith on, is that given these situations, that is a less of a risk than alternatives.
So I think what we've got to remember here is the purpose of screening. So the purpose of screening, particularly with cervical screening, is to try and detect changes that, in the case of cervical screening, may go on to become cancer in the future, to treat those at as early a stage as possible before that's even a possibility. So the fact that this has been a paused programme for just a period of 3 months, I wouldn't envisage that in these particular scenarios we're going to see a real rise in the number of late presentations with cancers. It still remains important that people attend these appointments. I would encourage women who have had their appointment paused to now re-engage with services to make sure that they're putting their appointments on, that they're getting back into that programme, that they're getting their screening undertaken, to make sure that if there are any changes that need attention at this stage, they can be done as early as possible. But in terms of the kind of broader screening programmes, as I say, the way that they're set up is to try to detect either cancerous or precancerous changes at as early a stage as possible so that treatment can be deployed at that point in time.
Thanks, Gregor. Rachel Watson from the Daily Mail.
Thanks, First Minister. Can I just go back to the air bridges quickly? You said there that it is reserved around border force, but under public health it would be devolved. Would that still require an agreement with the Home Office then to work with border force if you decided that quarantine would continue in Scotland and there wouldn't be air bridges? And then secondly, just on face coverings quickly, are you concerned that the decision not to ask people to wear face coverings was too late, and that's why people just aren't wearing them to shops?
On the first question, I mean, that would depend on the detail of what we were proposing. So rather than preempt that, we'll go through our consideration and decide what we're going to do, and then we will set out any implications of that. But the public health part of it, which as you can see, because it is contained in Scottish Parliament, Scottish Government regulations, is a matter for the devolved administrations. On face coverings, no, I don't think that. I think the issue with face coverings is that it's not something people are used to doing unless you work in the health service or in certain other sectors. Wearing something over your nose and mouth is not something that many of us are used to doing. And as I've found myself doing it on occasion in the last wee while, it's not the most comfortable thing. So I think that is probably what is leading some people still to choose not to do so. And I will continue to seek to persuade. We have made mandatory on public transport. We may make it mandatory in shops. But in the meantime, I'll continue to make the argument that people, for their own protection, because they get protection from others wearing them, and for everybody wearing one, we confer some protection on other people, then it is something people should do. And again, from my own, albeit reasonably limited experience of doing it in the last few days, you do get used to it. Something that feels at first as if you'll never get used to, you'd be surprised at how quickly it feels less obtrusive and a bit more normal. So please get into the habit of doing it, because we will be potentially living with this virus for some time to come, and these are the kind of measures that will help us keep it at low levels and then mean that other parts of our life can get back to normal more quickly. So, I'm not saying it's nothing, but it is probably a relatively small price to pay for keeping the virus at low levels, getting some normality back, and not having the virus, which, as we know, can have a big cost in terms of life. But as also we are learning more about almost every week right now, is that this is a virus that can do long-term health damage to people who don't die from it. So, wearing a face covering is maybe not too big a price to pay for the protection that it helps give. Mark McLaughlin from The Times.
Hello, First Minister. Can I return to the point that you were talking about with Scott and Peter regarding the apparent divergence in strategies? You said that you don't really know what the strategy in England is, which begs the question, maybe not for you, but why don't you know? Do you still take part in COBRA? And when was the last COBRA meeting you had? And what other cross-government discussions do you have about strategies?
There hasn't been a COBRA meeting for weeks. I can't remember off the top of my head the date of the last one, but I think the Health Secretary gave the date when she was at a Westminster committee recently. There hasn't been one since then. And I think that's regrettable. I think we should have more opportunities to discuss things on a Four Nations basis. That said, just for in the interest of accuracy and transparency, there have been Four Nations discussions. I've taken part in a couple of Four Nations discussions with the Prime Minister. There's also been Four Nations discussions that Michael Gove has convened. Some of them I've taken part in, and as I mentioned earlier on, Hamza Yousaf took part in one this morning. So there have been Four Nations discussions. I think we would all benefit from having more of them, but not just discussions that are about telling each other decisions that have already been taken, but genuine substantive discussions in advance of these decisions that allow us to go through a process that, if it's right for all of us, enable us to come to a genuine Four Nations approach. Why don't I know? Because it hasn't been obvious to me from what I've heard and listened to. I'm not trying to be overly critical here. I'm just being very clear with people what the Scottish Government's strategy is, which is to get to elimination if we possibly can, but also being clear that if that is our strategy and other countries or other parts of the UK have a different approach, which might mean infection levels are higher, then clearly we then have to consider how we mitigate against our infection levels rising. But as I said at the very outset of this, and it's a statement I stand by, this virus doesn't respect borders and boundaries. So where possible, we should be seeking to have a Four Nations approach, a joint Four Nations objective, and then agree the measures to deliver on that. And I'll continue to be very, very open to that in the period that still lies ahead of us. Adele Merson from the Courier.
Good afternoon, First Minister. You said in your earlier remarks that you would consider local lockdown measures. I'm just interested in how this might work in sort of practice. Are these likely to focus only on the exact location where the outbreak takes place, such as maybe a care home or a workplace? Or could it cover potentially a whole area, such as a postcode town or city? And also, do you think that these local lockdowns could be difficult to enforce?
Well, the straight answer to the first part of your question is that depends. It depends on the nature of the outbreak. So if you have an outbreak in a care home, to use one of your examples, or as has been the case in other parts of the UK and in other parts of Europe recently, an outbreak in, say, a food processing plant, then clearly you try to limit any suppression measures to the particular location. But if, and I'm about to mention Leicester here, and I do that with a degree of caution because I don't know all of the details of exactly what's happening in Leicester, but it seems from what I've read to be more of a a raised level of community transmission. If you have that, then any suppression measures may need to be more based on the whole locality you're dealing with. But what you're trying to do is, in however, preferably in as narrow a way as possible, but as broad as is necessary, is to suppress and contain and control without the need to go back to blanket lockdowns. And these are things, as we develop our surveillance mechanisms and are able to have much more granular information and forecasting about what might happen in different areas. These are decisions that would be open to us to take. But of course, if we all keep doing the right things, we can keep it under control in all parts of Scotland, which is my absolute preference. Do you want to add anything to targeted suppression?
This is just about a much more precise approach to public health response, and it's in some degrees that might be about outbreak management around about an institution or a facility, and then sometimes if there is evidence that it goes beyond just that outbreak and into sustained community transmission, but on a geographical local basis, then you might choose to take greater steps there. But I think the ability that we have now to look at data in a little bit more granular detail, to take information from the Test and Protect programme, all allows us to tailor the response in a little bit more precise way than perhaps we've been able to do in the past, and we would want to keep all options open.
I'm sorry, I didn't answer your question about difficulty of enforcement. I don't think these things are ever easy to enforce, and what we've found over lockdown so far is we have a mixture of measures that are in law and enforceable and other measures that we're asking people to abide by voluntarily, and as we come out of lockdown there is more in the latter category than in the former, and you know, whatever the enforcement picture was in the future in any of these hypothetical local arrangements, you know, we'd judge that at the time, but I'm a great believer that we get further in all of this if we persuade people of why we're asking them to do things. And again, I'm talking hypothetically here, but you know, the reason we could in the future, if we got into these scenarios, be asking people in a particular area to have some restrictions for a shorter period of time is to contain the virus and suppress it, stop it spreading over the country. Because if that happens, then we face the prospect of longer, more general lockdowns. It's a bit like Test and Protect. If all of us, if we have symptoms or if we are a contact of somebody who is positive for the virus, if we all agree to self-isolate for a period, then we are making a sacrifice to hopefully stop the whole country having to make a sacrifice again through lockdown. And these trade-offs and you know, these more individual or community sacrifices are all for the greater good. But let's hope we continue to drive the infection levels down nationwide so that these things don't become necessary in future. David Ball from the Herald.
Thank you, First Minister. Can I ask what response, if any, you've had from the Treasury to the formal request for extended powers? And do you think this crisis has highlighted that devolution hasn't been designed to be able to cope with a crisis of this scale? And what impact could that have on Scotland tackling future emergencies such as the climate crisis?
Okay, I'm going to hand over to the Finance Secretary.
Thanks for the question. I think that certainly the devolution settlement and the fiscal framework in particular, which is of course the rules that set out what we can and can't do financially, were never designed with a pandemic in mind. And in these extraordinary times, we need to see some of those rules relax so that we can use our budget most effectively in order to continue to invest. And obviously over the course of the last few months, we've invested over £4 billion in the initial response, but clearly there are additional costs that we know of, whether that's ensuring that our transport system can cope with social distancing, whether it's supporting schools or many other things that we have already announced in part. So we need maximum flexibility in order to do that. But the other point I would make is that, you know, I've been in discussion with Treasury for now a matter of months about those additional flexibilities. These are relatively minor in nature. These are minor fiscal flexibilities that most governments don't have to battle for, but can use quite simply in order to allow them maximum effectiveness when it comes to using their budget. So we'll continue to press the case. I think it's a very persuasive case. It's got cross-party support behind it. All parties bar the Conservatives have backed it. A number of independent think tanks have also backed the calls for additional flexibilities and powers. And in my mind, it's absolutely essential in order to allow us to continue to combat coronavirus, but also to support the economy and society to cope with recovery.
Thanks, Kate. And last question today is from Terry Murden from Daily Business.
Good afternoon, First Minister. Could I ask a question again of Kate Forbes? It's really following on from the last one, on the back of the stimulus package. Forgive me if it sort of goes over some of the same ground, but you've said that if you don't get these additional powers, we will be at a severe disadvantage to other nations. If the UK government refuses to grant these powers, or all of them, what is your plan B for preventing an economic meltdown in Scotland? And secondly, could I just ask, going back to the Higgins report last week, today another economist, Tony Mackay, has added his criticism to that of Professor Graham Roy at the Fraser of Allender and Professor Ross Brown at the St Andrews University School of Management, that it's a very disappointing, what he calls a very poor report, which produced nothing new, makes only one mention of SMEs in its 77 pages. There's a further claim from Tony Mackay that it appears to have been written largely by Scottish Government civil servants. Will you therefore be considering commissioning a new report from a more representative panel of business leaders that makes some practical recommendations?
I'll hand over to Kate on the fiscal part of the question in a second, but can I just deal with that latter part? I think that is unfair and unjustified commentary. Everybody's entitled to have their opinion, of course, that is the nature of democracy, but this was a report prepared independently by Benny Higgins and the advisory group. Anybody who knows Benny Higgins will find the idea that he would have been lent upon or allowed Scottish Government civil servants to write a report he wasn't happy with. I think, well, anybody who thinks that about Benny Higgins doesn't know Benny Higgins. I think it's a very good report. It is now for the Scottish Government to look at it and put forward its response, which we will do before the end of July. And what I'd say to everybody who has a point of view on this, whether they are academics, analysts or businesses or business leaders, is contribute, because we want all voices and we want all suggestions, because we want to have a collective and a collaborative approach to getting us through this crisis and into a sustained and sustainable recovery. So, let us have your views. If you have things that you want to put forward as alternatives or additions, let's hear them. We are absolutely happy to consider anything that comes forward. Kate.
Thanks. The starting point is that we will continue to use the levers that we do have and the resources that we have at our disposal in order to invest in the economy and support the nation through recovery. But, we've already done that with the £230 million capital stimulus a number of weeks ago. There's the £2.3 billion of support for businesses. But at the end of the day, we operate with a fixed budget. That means that we can't generate additional money in order to continue to invest in the areas that we want to invest in without seeing reductions elsewhere, which is something that I cannot countenance in a pandemic like this. So the 2 points that I would make is that in the paper before us just now, we are identifying areas where we would want to see progress where we don't have powers. Now, these are areas that have been flagged by businesses over a number of weeks in terms of a reduction to VAT, temporary and permanent, as well as a much more significant capital stimulus package. But the second point I would make is around flexibility within our own budget. Currently, we cannot use our budget as effectively as possible. And at a time when interest rates are at a record low, we should be investing, we should be stimulating the economy. We shouldn't be concerned about the fiscal rules that have been imposed on us in a fiscal framework that was never designed with a pandemic in mind. So I think those two requests are fairly reasonable requests to make. And I hope that having made the persuasive case, Treasury will now look upon this and see it as directly instrumental in ensuring that we can invest our way out of this crisis.
On the point of consensus here, the UK government, the Prime Minister himself, who I understand will say more about this tomorrow, are talking the language of economic stimulus and particularly capital stimulus. So we need to see that now translate into real money in order to, and additional money in order to make that a reality. So hopefully we can work together on what is required, and also there's a recognition of the broad range of support now for that greater flexibility in Scotland's own fiscal arrangements that would help us and equip us greater to navigate our way through what lies ahead. That concludes the questions for today. So my thanks to all the journalists, my thanks to Kate and to Gregor, my thanks to Jill, who has been our BSL interpreter for the day, and my thanks to all of you. Let me just end by reflecting again on the figures that I've reported to you today. If I turn my mind back a month, 2 months, I can't tell you, and well, I'm sure you understand this because you will have felt it too. I can't really find the words to convey how badly I wanted to be able to stand up here and say that we had a day, let alone 4 days in a row, where under the measure we used for our daily figures, no deaths had been registered from COVID. We're now in that position because of the sacrifices that all of you have made. If I have a worry just now, it is that we start to tell ourselves that the virus has just gone away of its own accord, so we can all drop our guard and go back to normal. So that's the point I want to continue to emphasise. The virus hasn't gone away of its own accord, and it will not do so. It is only at the levels it is at now because of all the things we've been doing. And if we don't keep doing all of the right things, it will come back. And we see other parts of the world where there are signs already of it creeping back. So let's keep doing these things. Facts is what I will continue to remind you of and emphasise to you. Face coverings in enclosed spaces, avoid crowded places, clean your hands and surfaces, keep 2 metres distance, and self-isolate and get a test if you have symptoms. If we all keep doing these things, we can keep this virus at bay and get it closer to that elimination level that we want. So my thanks to all of you for everything you are doing. We'll be back tomorrow. I'll be back here tomorrow with you at 12:30. But in the meantime, thanks for joining us today.